Great. Let me just, so we are just going to be discussing how things have evolved for you. I can already see the moment you saw me, there was a smile on your face. So that was actually nice to see. But what I want to sort of emphasize is, why is something like this an important thing for a man, and why and how it has actually ended up changing things for you. So that is the whole crux of what I want to be planning today. And so let's just start with you, and uh, just tell us a few things about yourself. That will be very interesting to hear.
Okay. Yeah, sure. I actually have a insurance agency. I'm actually an entrepreneur. I have a few businesses. This one, actually, it's an insurance company. So I have an insurance agency here. And I've been really big into yoga and meditation, which is kind of what attracted me to the East,
Right.
more specifically India. And because of the balance that I was looking for in my life between secular and non-secular, I mean, spirituality and professionalism, um, drew me more towards wanting to visit. And that's how how I found you also, because outside of my spiritual life, I've had this issue with um, weight loss. And
Yeah.
weight loss has been kind of one of the things that has been, kind of a roller coaster for me. And through that roller coaster, developing, gynecomastia is definitely very difficult, especially in the professional world, because certain, you can't wear everything you
Well,
want to wear.
I'm going to come on that. I'm going to actually touch that aspect where why it made it important. But my so this question is, so it's interesting that you being in a line of work where you actually have a few businesses, and there are people who look up to you in the society, and yet at a certain point you felt that the chest was not making you comfortable. So what did it make you feel like?
I mean, it made me feel incomplete. You know, if I can say that I didn't feel masculine. I felt aged older than I actually am, because after a certain age, some certain men develop, a fleshy chest. And I'm thinking, I'm in my early 30s. I don't, I shouldn't be experiencing this, but I've experienced that for majority of my adult life and teenage life. So it's kind of one of those things where if you are in the eye of the media, then you want to look accordingly, and then certain um, attributes don't necessarily go so well in the professional life. It's not like you would be you know not neglected, but it's not like you won't be professional if you have man breasts, but it's just kind of like it's like an unstated quality of a man just to have, if you're professional.
So what all activities in your life did you feel that they were getting restricted, like sports or what? I mean, in general, where did you feel restricted?
In certain suits, certain clothing, I just didn't feel like I could wear, and it was kind of, I mean, it was just more along the lines of not being able to buy things because, that shirt, that's good.
Let's forget it, chuck it some other day.
Yeah. You got to wear jackets and baggy clothing. So many things.
And so you of course lost a lot of weight but losing weight also did not help too much.
Yeah, yeah. Weight loss for me was good around my stomach area or other parts of my body, but for my chest, didn't make a difference. You know.
And probably, in fact, because when you did come to me, not only was there gynecomastia, there was also a lot of skin sagginess, which was an after effect of the weight loss, which I think made it worse for you.
I could agree. I agree. Yeah, it was. Yeah, I sometimes when I'm going through pictures on my phone, I see the old pictures that I had, and
Yeah,
it's, it's kind of bad.
it is. And I'm sure you get the feeling that why did I not do this before?
Yeah, yeah, yeah. Also to get the to get the gynecomastia surgery and also go to India.
that's, uh, that's interesting. Now, so your trip to India, of course, there was a lot. We had already pre-planned everything. But did you have an hesitation of coming to India for a treatment?
No, no. Mind you, I've been studying, you know, Vedic philosophy for a long time, and a lot of my friends from all over the world travel to
Mhm.
India and make it quite a habit to get surgery done. So um, I knew I wasn't just going to go to anybody, so I looked to see who had the most credentials, and and also when we communicated, I paid attention to the quality of her staff, and the customer experience was superior, and so I felt that if you already have so many accolades in different publications, and you have staff that's very prompt and professional, then I can put my faith in that.
And in fact, you will also notice that even after the surgery, you might so Sapal from my team or myself, we were still always in touch with you till you had healed up completely.
Yeah, yeah. Now that's also one of the other things that I really appreciated is that through the whole process, through beginning to you know even up to today, there's still a concern and there's still care. And so I definitely appreciate that.
So do you feel, no, I'm not very familiar with the American way of working, but suppose you had done a surgery in the United States of America, do you think the hospitality part, the reach out to you part would have been similar, or did you feel that in India it was a lot better?
Um, I have 90% surety to say that to the degree of the professionalism and to the attention to detail, um, your staff outshined most American
Wow.
places. Yeah.
Wow, that's a huge thing to say. I mean, I'm honestly very, very overwhelmed by what you've just said. This is amazing to hear. This is simply amazing to hear, and that's actually quite overwhelming. So, no, of course, you had one of the most severe grades of gynecomastia that I have seen in my life, and for me, it was particularly a big challenge. Uh, but we did so there was a technique which I do where I do a skin lift. So we had planned that for you. Did the whole surgery thing go as per what you had thought in terms of the pain, the recovery, the return to activity part, or was it better than what you thought?
So the pain was actually more than I thought. The
Okay,
pain was
okay,
actually a lot
yeah,
more than I thought. But recovery, I felt, was pretty consistent with the timetables that you gave me.
yeah.
Um, yeah, the
So,
recovery time.
yeah. So you were very clear with the timetable of the recovery, which we had already discussed, and it actually followed that.
Mm-hmm. Yeah, yeah, everything was clear.
And of course, you did a couple of days. I think the next day or the day after, you actually traveled down for your meditation and your, the search for the spiritual thing that you'd actually come to India for. Am I right? I think it was the next day itself.
It was it was the next day. Yeah, it was the next day.
In fact,
yeah.
And you had no problems in that. And I remember you actually saw me just before you flew out. I think you were on the way to.
Yeah, we were. Yeah, it was busy, but yeah, we were on the way to the airport. You saw me, and then I left.
Yeah, actually. Yeah. So what that just means is the whole process is very streamlined. It does not need a lot of medical care in the post-surgery period. And you were pretty much on your own as soon as the next day and managed to do your normal stuff. Isn't that correct?
Yeah. 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 That's correct.
Yeah, that's so it gives us the confidence that we know what we tell patients is actually correct. And so we just don't tell them just for the sake of it. So that's amazing as well. Now, you came back to the United States, and how would you say, how is Keith today different from what Keith was 3 years back?
I can say the most overwhelming noticeable difference is that I can put any shirt on with confidence, and as I see, as I lose more weight, I feel more confidence there. And I started doing, hundreds of push-ups a day.
Wow.
To, kind of, yeah, just to, give me.
And you don't have any
definition.
Exercise. And you don't have any problem in physical workouts, exercising. It's all normal, like it was.
Yeah. Everything's, as far as utilization of the same muscles. Yeah, everything's the same.
So last two questions I'm going to come to you before we break off. One is related to the cost. Now, for example, I'm not really again aware of the American system, but in terms of percentages, compared to an American surgery, what percentage is the cost in India?
A little over a fourth. A fourth. I would say
25, 30%. Thereabout. Somewhere. Yeah. So in fact, even if there's someone in US who wants to fly down, take the flight, get the surgery done, go back, it still works out to be much cheaper. And
stay in India for a month at a nice place, yeah. And still
for a month, you said, wow. So that's a holiday and everything, and that's awesome to hear. And Keith, my last question to you: if there's a patient, if there's a friend, a family member, or a stranger who comes and tells you that, Keith, I think I have gynecomastia, do you recommend that I should go for a surgery? What is going to be your answer to that man?
I would say absolutely. I would say if you have time, go to India.
Oh, that's a lot. That's a lot.
It's funny because a lot of family and friends are like, why didn't you do it in the States? And I was just like, well, even though I have the money to do it in the States, I was like, why do it in the States when I can do it in India for less and be, in the land of, Vrindavan and Krishna and everybody else.
and it's not about just saving the money, but it's also getting a better, as you say, a better hospitality. And you also achieve the second aspect of going to Vrindavan. So I personally am a devotee of Vrindavan as well. And we follow Krishna a lot. In fact, the temples in Vrindavan. So we do go there a lot as well. So Keith, I think it's been an absolute awesome 15 minutes that we've been conversing, and I really appreciate you taking your time out. And I do. How is COVID there in US right now? India is getting destroyed. But how is it there in you?
The cases are still here.
Mhm.
However, because of the vaccine, a lot of states are removing their mask requirements for businesses. I mean, I guess it's still here.
It's
You know.
there, but yeah. Great. So do say a big hi to your partner from my side, and just and it'll be awesome to be in touch as and next time you come to India, I know once COVID settles down, I invite you to be my guest for a lunch at home, and it'll be an absolute pleasure to host you.
Sure. Thank you.
Thank you. Take care.
All right, Doc. Thank you. All right.
So friends, आपने देखा किस तरह से how एक international patient US से आते हैं, and then he says that the care in India जो उनको मिली, that was much better than United States of America, and that is what we do. We actually are able to create a much better experience. So हमारे patient ने हमको कहा कि he has the money to spend in United States, लेकिन he still will always prefer India because of the care and the results. And you could make out that and in fact उनका gynecomastia का जो treatment था बहुत ही मुश्किल था, बहुत बड़ा chest. मैं आपको in fact दिखाता हूँ उनकी क्या condition थी, because this is something that I really wanted to show. Just 1 second if I can share screen, and within a minute I'll show you कितना severe उनका gynecomastia था. ये देखिए. It's not opening, but amongst the most severe the gynecomastia मैंने आज तक देखा है grade 4A, that it was. So thank you all everyone for joining me here today, and it's been an absolute pleasure to talk to our patient and interact and answer questions as well. Thank you and good night.